is Ms. Tara Maxwell here to answer questions about giving first aid, clarification on certain techniques, and on the overall process of providing first aid. Thank you, and please enjoy.
Everyone, my name is Tara Maxwell. I'm currently a registered nurse with 2 years experience in the Level 1 Trauma Center here in Houston, Texas. I currently work in a neurovascular ICU, which is critical care for traumatic brain injuries.
Thank you, Ms. Maxwell, for participating in my interview. We'll jump right into the questions. The first question is, what is the best advice for someone in a medical emergency, for instance, how to conduct themselves?
The best advice that I would have to give anyone in a medical emergency would be, 1, don't panic. Remain calm and think. Have someone stay with the injured party, if at all possible, while someone else goes to get help.
Thank you. The second question is, what are ways to evaluate an injury? For instance, telling the difference between a sprain, a strain, or a fracture.
The first thing you would want to do when evaluating an injury is sprains and strains they're typically muscle or tendon injuries, so there'll be pain on those weight-bearing sites. There may also be a little bit of swelling. If there's a fracture or a broken bone, you may see some protruding outside of the skin that will be abnormal. What you would want to do is, again, stabilize that particular injury, keep weight off of it, and elevate if possible in order to prevent further injury.
Okay. The third question is, how can you help someone who is on the verge of becoming unconscious, and once they lose consciousness, what can you do?
My advice for someone that is about to lose consciousness would be to assist that person in a fall. An assisted fall would be getting behind that person and helping them to the ground gently, and most importantly, protecting their head to prevent any type of brain injury. Becomes unresponsive, it is important to initiate CPR measures at that point in order to keep blood and oxygen circulating through the body.
And the fourth and final question, can you explain the difference between the role of a doctor, a nurse, and an EMT?
Your EMT are your first responders. That's who you call in the event of an emergency. They're there to stop the bleeding, so to speak. They stabilize the patient and get them to a hospital. The doctors are the ones who write orders, and they'll perform any type of emergent procedures necessary. Your nurses carry out the orders written by the physicians. They also give medications per those orders as well.
Thank you for participating in my interview, Ms. Maxwell. We will now be moving on to the interactive portion.
My pleasure.
For our interactive portion, we have our certified nurse. She has been walking through the woods and has been taking selfies. She has slipped and fallen and is now injured. She has possible broken bones and a possible dislocated shoulder. Through making a makeshift splint and sling, I will show you how to stabilize these injuries. So, because Miss Maxwell may have broken bones, I will be using a soft splint to stabilize her broken bones. So, what you do is you wrap the magazine. You can use a magazine or a book, but I just use a magazine. So you will wrap the magazine around and use it as a splint, and I will be securing it with masking tape so that it does. I will be securing it with masking tape so that it does not slip, fall off, or do anything that could further injure her. When stabilizing the splint and wrapping it, you don't want to apply too much pressure, and you don't want to wrap it too tightly so that the person injured does not experience loss of circulation. This is noticeable if their skin discoloration.
You can tell that there's a loss of circulation due to discoloration of the skin. Usually it'll turn blue, purple, or black. Now that the soft splint is secured, you want to allow the person to be able to rest their arm. Usually you'd have them rested against themselves, and then you'd move on to making the sling. With the sling, you'd use any triangular shaped fabric. You can also make the fabric triangular shaped So what I'm going to do is I'm going to start off by folding my fabric in half diagonally, and I'm going to take these two ends and create a knot. The knot is used to stop the arm from slipping out of the sling, again from preventing further injury. Once the knot is created, the fabric should look something like this. Not exactly triangular shaped, but you use what you can work with. So I use this, I lift the person's arm up a little bit, I have them rest their arm back against themselves, and I take one end of the fabric and rest it against their shoulder.
The purpose of the sling and the soft splint is to keep the arm leveled and elevated so that you do not increase swelling or cause any further injury swelling. I will use this piece of fabric to further secure the splint and sling. I will have the person lift their uninjured arm up. Can you please sit up for me? With this piece of fabric that is tied around Miss Maxwell, I will be using it to prevent flopping of the arm to where her arm's not hitting herself while she walks or while she's moving. So I just tie it around her back. Again, I had her lift up her uninjured arm so that I'm not preventing movement freely. And I just tie it in a knot behind her. And it allows her to be able to move more securely with the sling and splint on her. Thank you.
Thank you, Ms. Maxwell, for your participation. Do you have anything to say on your event this evening?
Well, I'd like to first say that Corey did conduct herself just as one should in an emergency. She didn't panic. She was well thought out. Her sling is very tightly secured. Her splint is serving the purpose for keeping the arm stable, and additionally adding that additional piece of fabric for security also helps, and I don't have any preventing movement of the other arm. So I would have to say this was very well put together. Thanks, Corey.
Thank you.